In any case of a stroke, the chances of a recovery, whether full recovery, partial recovery, or no recovery at all, usually depends mainly on the extent of brain damage that the person suffered from. And this extent of damage is also largely influenced by the timing of intervention. This is your ERNS channel on YouTube. Today we are going to talk about how quickly you can identify a case or a situation or an episode of stroke so that you can seek immediate help to minimize the extent of damage to the brain cells. Identifying a stroke is not really difficult to do, but it is quite tricky to notice. So we have this acronym that we use to help identify a scenario or a case of a stroke. This is known as the BEFAST or BEFAST, which is BEFAST. Without wasting much time, let us delve into what each of these letters stands for in the acronym BEFAST. To begin with, the B in the acronym, the B that begins it, stands for balance. Balance. So in a case of stroke, usually what you notice is the person, if the person is standing or the person is walking or sitting or even driving, the person suddenly starts going to one side. Okay, the person starts developing weakness in a particular side. So it can be the left side or it can be the right side. So the person is standing and then begins to fall towards that side, or the person is sitting and suddenly starts leaning towards that side. Not because the person is intentionally doing it, but you realize that the person has lost control over that particular side. So the person starts going to that side. If they are standing, usually they fall, and that is one of the clinical signs and symptoms that they bring to the hospital with sudden falls or sudden collapse. Yes, so balancing is the first step that you can use to identify whether somebody is suffering from an episode or a case of stroke. The second letter E in the acronym BEFAST stands for eyesight issues or eye changes or eyesight problems. So you suddenly see that the person starts having difficulty seeing it, either one eye or both eyes, or the person suddenly begins to have blurry vision in one eye or both eyes, or the person starts complaining of not seeing well with one eye or both eyes. So this is when you realize that maybe the person is going through an episode of a stroke. But sometimes people also experience eyesight changes in certain conditions like eye problems which are not related to stroke, or even high blood pressure and then high blood glucose levels. So this might not be a defining characteristic of a stroke episode, but then that is why we have other signs and symptoms. So let's move on to the next letter, which is F. Now, the F in the acronym BEFAST is one of the most predominant and most defining characteristics of an episode of stroke, and one of probably the most common sign of stroke. That is face drooping. So you realize that the person suddenly starts having one face, either the left side or the right side, suddenly gaining weakness and kind of melting, like in the frozen animation where you see Olaf the snowman, when he's exposed to summer conditions, starts having his face melt, and yes, that's how it looks like. Just that with this one, the face doesn't actually melt, but it suddenly loses its muscle tensivity and then starts drooping or falling downwards as compared to the other side, which is stable and then the person has control over. So face drooping becomes the first and most predominant characteristic or defining sign of a stroke episode. If you are still not sure, we can move on to the next one, which is the arms. So when you realize that the person's face starts drooping and you want to be sure or you want to be certain to verify whether it could be an episode of a stroke, you could just tell the person to raise both arms successively, so one after the other. So you start with letting the person raise the arm that is at the side that you realize the face is regular or the person has control over. So let's assume that my left side has the weakness. What you tell me to do is to raise my right arm. And if I'm able to raise it and extend it and have control over it, then that means that this side is working. Then you move on to tell the person to put this right side down and then raise the left arm. You realize that even if the person is able to raise it, the person might not be able to raise as high and extend it as well as they're able to do with the right side, which they have control over. Sometimes too, when it prolongs, the person might not even be able to raise the left side at all. That could show you that the person is actually going through an episode of a stroke. And then we move on to the next one to assess, which is the speech. So in the speech, all that you tell the person to do is to speak, or you ask the person a question. Of course, a question that you have an answer to, and you know the person can have an answer to. You can just start with what is your name, or how old are you, or are you okay? Like something just to keep the person to talk. And if you realize that the person is not able to talk, or the person has slurred speech, or the person might even start sounding confused, like you ask the person, what is your name? And the person is talking about something completely unrelated. That could be a sign that that particular person is going through an episode of a stroke. Now, if you have reached this level so far, you are done with the speech and you are certain that the person is having slurred speech or confused or cannot speak at all, then quickly you move on to the last step, which is the T, which is time. Time to call, time to intervene, which is the most important step of this entire acronym. Because don't forget that in the beginning of the video, I told you the chances of a full, partial recovery depends mainly on how quickly you intervene to prevent extensive damage to the brain. So you call, or if you can't call the ambulance or you can't reach out to any health center, quickly transport the person to the health center and get the person treated to prevent extensive damage to the brain and as such help the person's full or even partial recovery. And don't forget one thing, most of the cases of stroke which come to the hospital or present to any health facility usually have an underlying condition of high blood pressure, hypertension, which most of the time is not being managed. Most people come, they are aware that they have high blood pressure, but then they stop taking the medications for whatever reason. Some complain of side effects, but instead of reporting to the hospital and getting their medication changed, or even maybe the dosage reduced or anything to help, they just sit in the house and then they decide not to take it again. This is wrong. If your medicine gets finished, report to the health center. If your medicines are giving you side effects, report to the health center. Or if you want a change in your medicine, still report to the health center. One other thing is that in such a busy world where everybody is trying to make ends meet and live life, most people do not really have time to check on their health. So people are there, they do not even check their blood pressure at least once a month. They don't. It is very crucial that in this particular period of time and with the stress of the world that is going on currently, you consistently report to the healthcare center and get your blood pressure checked and then your blood glucose checked as well. And if there is anything that you can do about your weight, then keep your weight in check. These are simple practices that can prevent or reduce your chances of developing a high blood pressure, diabetes, or any other disease or condition that can lead you to a quicker chance of having a stroke episode or a stroke condition. Until the next video, enjoy your day and don't forget to follow and then comment.